Disease prevention and hand hygiene. Avoid contact with blood and bodily fluids. What to avoid? Stay away from contact with another person's blood and bodily fluids, such as vomit, saliva, mucus, urine, semen, and vaginal fluids. All of these could contain traces of blood. Why? Possible exposure to blood-borne pathogens, or BBPs. Since infectious microorganisms exist in human blood, coming into contact with blood can cause diseases. This is what happens with blood-borne pathogens, or BBPs. A BBP is a disease that is carried and potentially transmitted through blood and other bodily fluids that can contain traces of blood. Common BBPs include hepatitis B, hepatitis C, and human immunodeficiency virus, or HIV. These BBPs are usually transmitted through cuts, abrasions, and hypodermic needles, through body cavities like mouth, eyes, or nose, and through sexual contact. The symptoms of BBPs do not always manifest immediately, so people with these diseases could be infected for months. This leads to potential problems as those infected interact normally with others, leading to the possibility of others being exposed to BBPs of those who are unknowingly infected. A good tip to avoid any such BBP issues is to always treat bodily fluids as if they are infected. Ways to prevent contact. As a teacher, you should follow your school's exposure control plan. This usually means calling a custodian for cleanup. Do not try to clean it up yourself unless you have been trained, properly equipped, and designated by school to do so. If you do have to clean up a blood spill, follow these universal precautions, because they are the best defense against infection. Universal precautions are the procedures that can be used to prevent the transmission of BBPs when providing first aid or health care or cleaning up bodily fluids. Use personal protective equipment, including disposable gloves, protective eye goggles, face shields, aprons, and any other necessary materials to place a barrier between you and potentially infected fluids. Getting vaccinated against viruses, helping to stop the spread of disease. What is a vaccine? A vaccine is a substance used to stimulate the production of antibodies and provide immunity against one or several diseases. There are many vaccines that help prevent diseases, such as the MMR vaccine, which helps prevent the measles, mumps, and rubella, and the Tdap vaccine, which helps prevent whooping cough, and the IPV vaccine, which helps prevent polio. These are just a few of the many vaccines. Why should I get vaccinated? When a critical portion of a community is immunized against a contagious disease, most members of the community are protected against that disease because there is little opportunity for an outbreak. Even those who are not eligible for certain vaccines, such as infants, pregnant women, or immunocompromised individuals, get some protection because the spread of contagious disease is contained. This is known as community immunity, or herd immunity. Because of vaccines, most of the deadly childhood diseases, such as polio and measles, have been eradicated in the United States.
Cases linked to the Disneyland theme park continues to grow. Doctors weigh in and sound the alarm.
Vaccines are one of the greatest achievements in the history of public health.
We thought we had measles essentially licked.
So why is this disease coming back from the brink of extinction?
People are deciding they're afraid of vaccines.
And that fear is putting the nation's health at risk. How did we get to this point where personal belief is more powerful than science?
They get this monster shot. You ever see the size of it? It's terrible.
We vaccinated our baby and something happened.
When someone's already sucked into that myth, it's a very difficult thing to talk them out of it.
1950s, the Salk vaccine was greeted with open arms.
Civic clubs had immunization parties.
Polio, smallpox, diphtheria, no longer a threat in the U.S. because of vaccines. And in 2000, another watershed moment.
The CDC reports the measles practically wiped out tonight in the United States.
But that report proved overly optimistic. Measles are back. More than 600 cases were reported in the U.S. in 2014. And another disease that looked like it was disappearing a generation ago is also making a comeback. Whooping cough. Unlike measles, its return is in part attributed to the waning effectiveness of its vaccine. But it shows how the spread of a disease can impact the most vulnerable.
The risk of whooping cough may sound like something from the past, but it's still very real. Today, California reported more than 4,200 cases. 9 people have died, all of them infants.
For San Francisco mother Mariah Bianchi, those numbers are more than just statistics. When her son was born in August 2005, as an He died 17 days after he was born. Vulnerable people, like newborns, depend on the immunity of those around them to protect them from dangerous diseases. To keep measles from spreading, for example, about 94% of a community needs to be vaccinated. It's called herd immunity. In some areas, that's a concern.
Here in Marin County, California, you have pockets of people who are not vaccinating their children. There are certain schools and communities where that rate is as high as 50%. And what I fear is that we have an epidemic of measles, an outbreak, and that we have children that are very ill or that die.
The measles vaccine has been so effective, it doesn't seem like something we need to protect our children from. You have this sort of fundamental paradox of vaccines that they've become a victim of their own success.
Seth Mnookin examines the fear of vaccines in his book, The Panic Virus.
The current vaccine scares and controversies that we're still dealing with today stem from a 1998 paper that appeared in The Lancet, a very respected medical journal published out of the UK.
The paper, written by Dr. Andrew Wakefield, claimed there might be a connection between the measles, mumps, rubella vaccine and autism.
In his press conference, Andrew Wakefield stood up and said, parents should not give their children the MMR vaccine, period, until we are able to get to the bottom of this.
The MMR vaccination combination, that I think that it should be suspended in favor of the single vaccines.
The notion that you would take a 12-person case study and make claims about a population as a whole is ridiculous. This paper was historically bad. And what the media in the UK did was they ran with that.
It's a dilemma.
You know, that's a sensational story.
Follow-up studies of hundreds of thousands of children could not find any evidence that the MMR vaccine causes autism. And investigations into Wakefield's original paper revealed he distorted the data and acted unethically.
He's lost his medical license. The Lancet paper has been retracted, but he had very effectively positioned himself as a martyr. And in some odd way, every piece of evidence that comes out against Wakefield
Wash your hands. Why wash my hands? Washing your hands is the best way to stop germs from spreading. Think about all of the things that you touched today, from the telephone to the toilet. Maybe you blew your nose in a tissue and then went outside to dig around the dirt. Whatever you did today, you came into contact with germs. It's easy for a germ on your hand to end up in your mouth. Think about how many foods you eat with your hands. You can't wear rubber gloves all day long, but you can wash your hands so that those germs don't get a chance to make you or someone else sick. When should I wash my hands? You should wash your hands frequently throughout the day, including if your hands are dirty, before eating or touching food, after using the bathroom, after blowing your nose or coughing, after touching pets or other animals, after playing outside, and before and after visiting a sick relative or friend. What is a proper hand washing technique? 1. Use warm water, not hot or cold, when you wash your hands. 2. Use whatever soap you like. Antibacterial soaps are okay to use, but regular soap works fine as well. 3. Work up some lather on your hands on both sides, your wrists, and between your fingers. Don't forget to wash around your nails. This is one place germs really like to hide. Wash for about 10 to 15 seconds, scrubbing really hard. Wash for about how long it takes to sing a happy birthday. Sing it quickly 2 times or just once if you go nice and slow. 4. Rinse and dry well with a clean towel.